There are some other transmitters and modulators that are important to discuss, for example histamine, nitric oxide, and anandamide. Starting off with histamine, which is a relatively minor transmitter in the brain, but H1 antagonists cause sedation and have antiemetic actions. Nitric oxide synthase, NOS, is present in about 1 to 2% of neurons in many areas of the brain, for example cerebral cortex, hippocampus, and striatum. Nitric oxide has been shown to have many actions in the brain, and it is believed to have a modulatory role. It affects the release of other transmitters, and there is evidence that it may be involved in synaptic plasticity, for example long-term potentiation. No therapeutic agents are known to involve central nitric oxide, but important drugs acting via nitric oxide are organic vasodilators used in angina and phosphodiesterase, 5 inhibitors used in erectile dysfunction. Anandamide acts at cannabinoid CB1 receptors and is termed an endocannabinoid. The role of anandamide is unknown. However, CB1 receptors are involved in the actions of tetrahydrocannabinol, THC, the active constituent of cannabis. Other than these, neuropeptides form the most numerous groups of central transmitters. Substance P and the enkephalins are involved in pain pathways. Opioids are agonists at enkephalin receptors. So that was all about a quick review of neurotransmitter pharmacology. Watch out for more pharmacology lectures only on sqadia.com.